Welcome to Falling Through the Cracks. Feel alive and thrive with Dr. Rebecca Risk. Do you ever feel that even though nothing seems seriously wrong and you pass all the medical tests, that you still feel that your health, pain, and fatigue are completely out of control? It doesn't have to be that way. Listen to the tips and suggestions given on our program today and take back control of your health. Now, here is Dr. Rebecca Risk.
Hi everybody, welcome to Falling Through the Cracks. Today we're talking with Seth Gillihan. He is a clinical assistant professor of psychology in the psychiatric department at the University of Pennsylvania. We're discussing his most recent book, Cognitive Behavioral Therapy Made Simple. Seth, welcome to the show.
Thank you, Rebecca. It's great to be here.
So what inspired you to write this book?
You know, the book I'd written before, Retrain Your Brain, was a workbook. So it was focused on ways to treat depression and anxiety within a pretty structured 7-week format. And so there are a couple aspects of that I wanted to kind of add to in a subsequent book. One is we had thought about including a mindfulness component in that one, but just because of the space limitations, we weren't able to really do it justice, so we didn't include it really besides, I think, mentioning it. And the other part was we wanted something for people to use who didn't necessarily need to go through the whole workbook, the whole 7-week program, and instead might want a resource they could come back to, they could kind of sample from the chapters that were most relevant. And so I got to address both of those things in this book, and the publisher was very interested in a follow-up to Retrain Your Brain because the book had a good reception and was doing well, and so those things kind of came together, and I also got to expand what we were focusing on a little bit too, to also include anger, which I really hadn't addressed in the previous book. So yeah, I was really happy to have the chance to bring those different threads together in this more recent book.
So I think it might be important to know what cognitive behavioral therapy is so people can understand.
Yes, absolutely. And, to some extent, the specific definition depends on who you're asking. But what people tend to agree on is that CBT, as it's also called, involves addressing the thoughts that we have and understanding what those thoughts are and how they affect our behaviors and our feelings, and addressing the behavior patterns that we have and the things that reinforce our behaviors and the outcomes of those behaviors, and how behavior is related to thoughts and feelings. So you'll often see this model of CBT, which examines the ways that our thoughts, our feelings, our behaviors all interact with each other and are affected by each other. And it's a pretty simple model. It's pretty straightforward, and I think that's what appeals to a lot of people about CBT, is that it's a pretty straightforward approach. It tends to be relatively brief as therapies go, and it focuses generally on a pretty well-defined problem or goal, and the idea is to help a person move toward that goal as quickly as possible.
So I know one thing that is very traditional for us to think is that we can't change how we think or how we are, that are once we're set in our ways. I guess the old saying, you can't teach an old dog new tricks. But what you're saying, of course, is that that's not the case. So can you just explain that for us a little bit?
Yes, it's a great question, because that is often the assumption that, we've seen ourselves or we've seen other people behave in the same way or similar ways for a long time, and maybe we've made efforts to change and they haven't been successful, and so maybe we kind of throw in the towel on ourselves or on other people. We say, well, I guess people really can't change, and there are parts of ourselves and tendencies that we'll probably always carry with us. But one of the real benefits of CBT is recognizing that there are factors that affect our behaviors and other patterns that we might not be aware of. And a lot of the work in CBT is in identifying what those patterns are, because we get conditioned in certain ways. We might always repeat a certain action and not understand the things that led to it. Maybe the way that we're rewarded for doing that behavior, even though it doesn't seem to make any sense. And so by practicing things in a more systematic way, understanding our patterns and then coming up with a plan, often in collaboration with a therapist, we're much more likely to be able to break those patterns and build new ones that are more effective and ones that we can keep practicing and strengthening long after therapy is over.
So how is CBT, cognitive behavioral therapy, different from your traditional talk therapy where you would just go in and hash out what was going on?
Yeah, well, it's got a lot of overlap in terms of, ideally, and I think most of the time we're with, sitting with a supportive person who wants to be helpful to us, and just that human connection and an outlet to discuss things can be really helpful, and feeling understood and heard. All those things are a part of CBT. And then what tends to distinguish it, although the boundaries seem to be blurring to some extent, but it's going to focus more than a lot of therapies on doing work in between sessions. So it's often called homework. So practicing things that are talked about in session. There tends to be a lot of continuity from week to week. So if I'm working with someone in a pretty structured way in CBT, I may start the session by saying, so last time we talked about this and this, and you'd plan to do these things. How did things go this week? And we'll review some of the homework together, and then pick up the thread from the week before. So I think the structure and the continuity and again the specific focus on thoughts and behaviors and on ways to start to shift those are what distinguish CBT.
So can you just give us an example of what that would look like? Let's say, just looking at the cover of your book, and let's say I'm dealing with anxiety, because you list a few things that this can deal with. I'm sure it can deal with more than what's listed here. But let's say I'm dealing with anxiety. You talked in your book about social anxiety. So if I came in for a CBT appointment, how would that get addressed?
Right. So let's say the person in the previous session had identified some of the common thoughts that tend to come up in social situations, and some of the ways that they tended to react. Like maybe they tend to withdraw socially, or tend to have certain ways of talking with people, like maybe they're always trying to keep in mind the next question they have so the conversation doesn't stall out in an awkward pause. And so we would have worked in the previous session to shift some of those behaviors. So maybe the person had planned with a therapist to go to a party that they had thought of avoiding, and while they were there, to not just engage in conversation, but to engage in a different way. So I'm not going to stand in the corner. I'm not going to keep my hands in my pockets the whole time. I'm going to let the conversation flow a little more freely instead of focusing on how I'm coming across and trying to make sure that I have something to say, which actually ends up distracting me from what's actually happening in front of me. And so when the person comes back, we'll talk about, so how did that party go? And I think that expectation that we're going to review how things went, I think it tends to be one of the more helpful parts of the treatment, because I think we all need to, I guess in some sense, a way to be accountable, know that someone besides us is rooting for us and is going to be asking us how things went. And a lot of people I meet with have told me, wasn't planning to do this, but I knew you were going to ask me, and so I did it, and person can get a lot of benefit from it for that reason. So that's how it tends to look in social anxiety, and of course, in the process, we're going to talk about in general, how did your week go? So if something really important happened that wasn't on the therapist's radar, we're going to give the person a chance to talk about that. And I mention that because I think some people have the idea that I'm going to be so, as a patient, I'm going to be so kind of straitjacketed into this treatment. I'm not going to be able to talk about things that come up or emotions that I have unless it's just sort of part of the carefully restricted recipe of treatment, and that's not the case. At least that's not the case in good CBT.
So you lay out in your book things that are important and how this works. So one thing you talk about is collaboration and participation. Can you tell us what that is?
Yes. One of the fundamental assumptions of CBT, and I don't know that it's unique in this way, but certainly is part of the guiding way of thinking about it, is that the therapist and the patient meet as equals. And that's not to say they have equal roles. Their roles are different, but the person who's coming in is the expert on her life and knows what's worked for her in the past and what hasn't worked so well, and she's the one who's going to be carrying on with whatever she practices after therapy is over. And so there really tends to be a spirit of collaboration. It's again, when done in what I think of as the right way, that it's not a top-down type of relationship. It's not something where the therapist has the answer and the patient's job is to discover what it is, but instead to kind of mutually explore together. And so if I'm asking a person about her thoughts about a challenging event that came up, I really want to know what her thoughts are and want to examine them together. And I don't know. I think people often assume that a CBT therapist is going to tell them that their thinking is wrong. And in fact, that's usually not the case. There are good reasons why we think what we think. But instead, we're just going to think together about whether there might be more adaptive ways to think and to be in a person's life.
Well, from what I understand of where these core thoughts come from that are causing us issues, often we don't even understand where they come from. They might have been something when we were quite young, or a learned behavior from our parents that we didn't realize that we were learning. And it must be very difficult to even recognize that that's what's in our way if it's normal to us. If it's something that you grew up with, a behavior you grew up with, or someone telling you a certain thing, I can imagine that it's very difficult to even recognize.
Absolutely, Rebecca. That is such an important point, because that's where a lot of the work is in understanding what our thoughts are, and as you suggest, a lot of times we'll never know exactly where they come from. They may be ways of thinking that are sort of, as far as we can tell, in our DNA. They might be things we learned, as you said, before we were really able to lay down memories of those events, and just all the little things that we pick up on all the time. I think we're being patterned in ways that we just don't realize. For example, I think of this as sort of a tangential example, but baby names. I think parents often, I know for us, you pick names of babies just thinking like, oh, this is a nice name, I like this name. And then you find out, wow, this name is actually pretty common. Like, I didn't think of it as a very common name, but it's gotten quite popular. And so we're being affected in ways that we don't even realize. And so making those kinds of, I guess we might say, unconscious effects more conscious for ourselves is a lot of where we start. And then we can decide where we go from there once we have a clearer picture of how things are for us.
That definitely makes sense. We're going to take a quick break. We're talking today with Seth Gillihan, and we're discussing his book, Cognitive Behavioral Therapy Made Simple, and we'll be back shortly.
Become our friend on Facebook. Post your thoughts about our shows and network on our timeline. Visit facebook.com/Voice America.
There is a difference in health and wellness programs. There can be mainstream programs, and then there is something extra. That something extra is called Tips to Keep You Healthy, Happy, and Motivated, with your host, Kristen Harper. If you want to hear some behind-the-scenes talk radio when it comes to health and wellness, the why as well as the how, be sure to tune in each week. This show will inspire you to be healthy and happy for life, as well as become the best version of yourself. Listen Tuesdays at 3 p.m. Pacific Time, 6 p.m. Eastern Time on Voice America Health and Wellness.
When a woman is diagnosed with breast cancer, it's probably the most frightening thing that's ever happened to her. Friends and family often don't know what to do for support, not to mention the patient herself. That's where Breast Friends Cancer Support Radio comes in. Join Becky Olson and Sharon Hennepin, breast cancer survivors and advocates. They help by providing inspiration, information, and most of all, hope. Tune in Wednesdays at 9 a.m. Pacific Time, 12 noon Eastern Time on the Voice America Health and Wellness Channel, and Thursdays at 9 a.m. Pacific Time on the Voice America Women's Channel.
Can grief be good for you? Absolutely. It gets your attention, helping you evaluate your choices and relationships. Your losses define who you are. Tune in each week for Good Grief with host Cheryl Jones. Our show features those who have made incredible transformations by grieving their losses. You'll learn how to find your courage and strength. You'll discover the important things in your life and how to let go of things that are less important. Good Grief airs live Wednesdays at 2 p.m. Pacific Time, 5 p.m. Eastern on Voice America Health and Wellness.
Your life, your health, your network. You're listening to Voice America Health and Wellness.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back. Today we're talking with Seth Gillihan. We're discussing his book, Cognitive Behavioral Therapy. So, Seth, we talked about, the participation and recognizing the problems. But, as I mentioned before, I think it's really difficult for people to recognize the problem. And I know it might be easier if you're in a session with somebody who, of course, is trained to see, okay, this is the thought pattern that might be causing you some distress. How can somebody do that just using your book?
So the general idea is to pay attention to times when our emotions shift and maybe shift suddenly. So a common example is you're walking down the street, you're feeling basically all right, kind of neutral, and then you see someone, and after seeing the person, you don't feel quite as good. Maybe you feel a little like just this kind of like the feeling something bad just happened. And so if you identify that, you can think, all right, what just happened and what went through my mind? So maybe we saw someone and said hi to them, and they didn't seem very enthusiastic to see us. And that in and of itself doesn't necessarily mean anything, but we want to go beyond or beneath that surface level experience and ask ourselves, what did we make of that? What story did we tell ourselves about what just happened? And maybe we told ourselves, like, yeah, they're not very happy to see me, or oh, they're wondering why I haven't responded to their email yet, or whatever. But maybe we make some kind of automatic negative interpretation. And so we just want to pay attention to those types of things, because that's going to be the start of our discovery of what these patterns are, and then will put us in a place where we can start to modify those patterns.
So, and of course, this is what you have laid out in your book. And one of the next things that you talk about is emphasizing the present. So, can you just explain what that means?
Yes. So, some therapies tend to be more. They tend to focus more on excavating from the past and trying to understand what a person is dealing with now by kind of digging through past events, maybe quite remote events from early in a person's childhood, and then there can certainly be a lot of value in doing that. CBT is much more likely to focus on what's happening now. I think for the simple reason that that's where we tend to have the most leverage in making quick changes, making the kinds of changes that often bring a person in for therapy. So it's not that we ignore the past or think of the past as not at all important. I think quite the contrary. We can understand sometimes where our deepest thoughts and beliefs and behaviors come from by understanding the past. But we don't tend to stay there. We don't expect that just by identifying and recognizing those historical influences that's going to change things necessarily in the present. So that's why we tend to have a present-oriented approach in CBT.
Well, I just, understanding what I know about neuroplasticity, which is a lot of what you're working with, is just changing the brain patterns. I've often wondered, and I don't know if I'm right, so I'm going to ask you, if sometimes bringing up the past over and over in therapies is actually resetting what was created when an event or whatever happened, instead of moving forward to change it.
Well, yes, it's a great question. I think I would agree to some extent. I think a lot of it depends. I think you're absolutely right. If we're just kind of going over things and not getting any kind of a shift in our understanding or our perspective, then yes, we might just be we might think of it as like spinning our tires and just digging those ruts deeper and deeper and making it even harder to get ourselves unstuck. When you started describing that, it made me think of what we do in CBT for survivors of trauma, which is, to revisit those most painful episodes, those traumatic events, but not just for the purpose of retelling them, but to gain a different perspective on them, and by having that kind of shift in our understanding of what happened and our relationship with it, that's where the change really comes in. So yeah, I think you're really on to something, that it's not enough just to recount things and talk about them, but I think, whether it's in therapy or in talking with someone that's close to us that we trust, what we're really looking for is a shift in our story, a kind of change in the narrative that we tell ourselves about what's happened.
Okay, so I just want to see if I understand this properly. So let's say I experienced a trauma. Say I had a car accident and I have PTSD from this situation and I'm scared to drive. You would revisit this situation and have me view it with different thoughts or different emotions?
Yeah, no, let me clarify, because it's an important part of the treatment. So a common form of CBT would involve, gradually helping a person to get back behind a wheel and to get more comfortable driving again. The idea of kind of getting back in the saddle through retelling the memory of what happened, of that traumatic event, and then talking about it, talking about the accident. Most likely, what's going to happen is that certain thoughts about the trauma are going to come out that they're not only not helpful to the person, but they're not accurate. So a person might have the belief about the accident that, well, this happened because I'm a terrible driver, or this happened because I'm an irresponsible person, or I'm completely inept. And by talking about what actually happened and taking a close look at it, most of the time what we find is that those thoughts don't really line up with what actually happened. And sometimes it's just enough for the person to really walk through the event and picture it and remember it, to start to loosen up some of those beliefs and to question them themselves. Other times the therapist will have to kind of point their attention at things and say like, oh, okay, so you said that you're completely inept driver, so you've probably had a lot of accidents in your life. And they say, well, no, this was the first accident I've ever had. And so those kinds of questions can start to, again, shift a person's beliefs, and those beliefs are often what's maintaining the difficult reactions after a trauma. And when they start to change in a more adaptive direction, then a person's PTSD will start to improve. Does that help? Does that clarify?
Yeah, I think so. One thing that I know, of course, dealing with people who aren't well all the time, I know that although you can walk people through that, there are some times where people can actually justify that situation. They'll maybe see what you're showing them, but then they can still justify, no, it happened. So, and they're just so set in that way. So how can you help somebody get past that barrier that they have?
Right, yes, good question. Well, and there may be times when maybe a person really is a bad driver and they've had a lot of accidents. And so we're never going to try to talk a person out of reality. We're not going to try to paint a rosier picture than is actually the case. I mean, there are times when people really have made the wrong decision. And so in that case, it's not going to be a matter so much of changing their belief about what happened, but it's changing the implications about it. The person might believe I'm a terrible driver, and therefore I am a worthless human being. Well, that we can definitely question. Maybe the person really is not a good driver and needs to be much more careful, or maybe not drive at all in some limited situations that I can imagine. But regardless of their driving ability, what does that say about their value as a human being? Well, probably not much.
Yeah, we're none of us perfect at anything, but it is important. I understand where you're coming from. We take those things, those mistakes we make or decisions, and then we can blow those up. I think this is a very common human nature thing to do, to take it very personally and make it about ourselves, and then those the self thoughts that we go into about who we are, which then of course can recreate the problem. So if you have anxiety about driving and you think you're worthless, you're going to then get, say, social anxiety as well. And that's going to escalate from there because you haven't addressed that core feeling of what this has created, or what was there before this happened.
Yes, that's right. And I think that's where true compassion for ourselves comes in, is not in denying our faults and limitations, but in recognizing them and embracing ourselves nonetheless.
Yeah, definitely. I can see. So with CBT, you do address those negative thoughts, and you've got charts in your book of things that people can follow through. So can you just explain how you're getting people, especially as their homework, to assess those thoughts and recognize what they are and change them?
Yes, yeah, and there's certainly no shortage of forms in CBT. We really like to have people write things down, so it tends to be a form for pretty much everything. So with this kind of form, where we're taking a look at the thoughts, we want to identify what was the situation that triggered what we call automatic negative thoughts. So the thought, that like I mentioned earlier, I see someone, they don't seem that happy to see me, and so I think to myself, oh, they don't like me. That would be a negative automatic thought. And once I've identified the situation and the thought, I want to identify what I'm feeling. And just that sequence can be helpful to see, okay, this thing happened, I felt a certain way, but I didn't feel that way about the event itself. I felt that way because of this thought that came in between what happened and how I felt. And then from there, the second half of it is to start to question that thought. It may be exactly right. Maybe this person can't stand me. That'd be important information to have. But are there alternative explanations am I ignoring anything? Am I forgetting that this person has been sick or has a big interview that he's on the way to, and so he's just not that present to really respond to me? So once we've identified how accurate our thought might be based on evidence that supports it and evidence that doesn't support it and alternative explanations, then we want to come up with any revision to that thought. Is there a more realistic thought that might better match the situation, and ideally one that I can actually buy into, at least to some extent? It doesn't have to completely overshadow the initial thought, but hopefully it's at least something that seems plausible that I can start practicing as an alternative to those negative automatic thoughts.
Well, and so I just opened to the page. I think I have the right page. It looks like the chart, and you've got what you call thinking errors. So black and white thinking and overgeneralization and catastrophizing, which I think most people could probably see what that is. They either like me or they don't. This person has nothing else going on, so the fact that they weren't receptive the way I want, they don't like me. Whereas, as you said, perhaps they're really stressed out about something that's going to happen later that day, and they're just not being their normal selves because they're nervous. And you've got this chart laid out so that people can assess those feelings, which I think is really good because we don't analyze those things that just come into our head and then we go down. Well, maybe we analyze in the wrong way. For women are good at that anyway. But we might ruminate rather than really taking a close look at the thoughts. Exactly, the ruminating over this person doesn't like me, and then we go and we ruminate with someone else, and then we kind of solidify that thought instead of assessing what else was going on at that moment. And does that person need my compassion? Do I need my compassion? And assessing really what was happening. And even if they don't like us, is that personal? Did we do something, or are they just that way? Yes, that's right. We could catastrophize about someone's not liking us. Well, not everyone has to like us, and oh well. Exactly. I've seen charts similar to this before, and I really enjoy them. I think it's really important for us to go through this, especially the patients that I deal with who are, chronically ill for a long period of time. And it's actually difficult to deal with your emotions at that point. But then when you start to get better, if you don't assess those things that you went through, of course, you're going to be stuck in those patterns. And the mental health is just as important as the physical health when we're on this journey to wellness. So I love books like yours that make it, really easy for us to see that there is a path that we can go on to change these things. Well, I appreciate your saying that, Rebecca, because I didn't include this kind of chart in my previous book, and I was torn about whether to include it here. Do we need to talk about specific categories of these thoughts? I mean, I didn't invent these. These are ones that Aaron Beck and David Burns and others have talked and written about. But I agree with you. I think it is helpful to have these kinds of categories like, that's all or nothing thinking. That's catastrophizing, to be able to kind of quickly dispatch these thoughts once we've learned what our patterns are. Well, and if you can't have a word for it, it's the same as when people don't feel well, but they actually don't know, say, what anxiety or depression is, which actually happens a lot. It's really hard to understand what you're going through if you don't know what it is you're going through. And I think it's the same with the thoughts. If you don't know you've got this black and white thinking about how that person felt about you that day, you're not going to look at the situation and assess, okay, maybe they needed some compassion because of that interview. And it's important in our lives to, I think, have that broader picture, because what is missing in this world right now, I think, is that compassion for the people around us, and that would probably change a lot of things if just that expanded in everybody's lives. Wouldn't it? I know, I couldn't agree more. Yeah, I think so. We're going to take a quick break. We're talking today with Seth Gillihan. We're discussing his book, Cognitive Behavioral Therapy, Made Simple. We'll be back shortly.
Think you've seen everything there is to see in online television? Let us surprise you. Visit voiceamerica.tv today for sports, health, business, and more on demand 24/7.
Tune in every Tuesday for C. diff, spores, and more with host Nancy Kerala. Our program is to provide information about C. diff, healthcare-associated infections, and more. Nancy is a C. diff survivor, healthcare professional, and founder and executive director of the C. diff Foundation. Together with her guests, we'll explore C. diff infection prevention, treatments, environmental safety, and more. Listen every Tuesday at 1 p.m. Eastern Time, 10 a.m. Pacific on Voice America Health and Wellness.
Explore the power of natural healing with Howard Strauss. Join us each week for an informative program that'll help you learn effective healing methods using natural remedies. Howard's guests include top researchers, authors, and experts who will share their views on a variety of natural products and healing methods that really work. Tune in to The Power of Natural Healing with Howard Strauss, Mondays at 11 a.m. Pacific Time, 2 p.m. Eastern Time on the Voice America Health and Wellness Channel.
Everything is energy. It's all connected. Your energy can be seen as the foundation for your life and impacts all areas of living. Do you realize that your thoughts have the power to affect how you show up? Tune in for Healthy Energy with Margot, featuring host Margot Nielsen. Margot and her guests will show you that connecting to your energy is vital to your health, relationships, money, and more. Listen live every Monday at 12 noon Pacific Time, 3 p.m. Eastern Time on the Voice America Health and Wellness Channel.
Frankly Speaking About Cancer is a program designed to empower survivors and their caregivers to deal with the social and emotional challenges of cancer. The show will invite physicians, researchers, nurses, social workers, patients, and caregivers to share their advice on how to live a better life with cancer. Join host Kim Tibaldo, President and CEO of the Cancer Support Community, Tuesday afternoons at 1 p.m. Pacific Time and 4 p.m. Eastern Time on the Voice America Health and Wellness Network.
Opinions, options, answers. You're listening to Voice America Health and Wellness.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back. Today, we're talking with Seth Gillihan. We're discussing his book, Cognitive Behavioral Therapy Made Simple. So I want to talk a little bit about mindfulness. You mentioned that in the first segment. And, it's a common topic these days, which I think there is a reason. Just like what I said before the break, it would be nice if we could have more compassion in the world. How does mindfulness play into all of what we're talking about, our depression, anxiety, mental health? What does that do for us?
Well, there was a recognition a couple decades ago or more that the tools of mindful awareness can be really helpful as part of a therapy, and so it's actually considered the third wave of cognitive behavioral therapy are mindfulness-based approaches and acceptance-based approaches, and so the big idea is that so much of our suffering, including anxiety, depression, other overwhelming emotions like anger, come because we're resisting what is. We're kind of fighting against reality, and our attention is focused elsewhere. So a common example would be, worry. I mean, worry by definition is about something that is not now. It's something that might happen in the future, and so I'm not focusing on what's happening in the present, and I'm also trying to fend off something I'm afraid could happen. And so a really powerful antidote to both of those can be practices of mindfulness and meditation. So coming into the present, focusing on what's happening right now, which prevents my mind from running away with these kinds of catastrophic fears, and also accepting that I can't entirely control what's going to happen in the future, even though our minds would really love to be able to make sure things we're afraid of don't happen. And so I've said before, mindfulness practices they're kind of like sleep in that they seem to be good for pretty much everything. There aren't many struggles that we've thrown mindfulness at where people don't tend to find a lot of benefit.
So let's give an example. Let's say that I'm prone to anger, because that was something you brought up earlier, and I'm in a situation, let's say I'm driving and somebody's cut me off. What would I do to deal with the road rage and the anger in that moment so that I can be aware of it with the mindfulness?
Well, so yes, when I think about dealing with excessive angry reactions, I think anger tends to be kind of a hot and a quick emotion and an impulsive one, and so we want to find ways to slow things down, to take a brief pause, which can sometimes help us to make a better choice. So in that example, I might take a cleansing breath before I act, and even that pause might be beneficial. And I'm going to want to be aware, kind of in the moment, in the present, what's happening in my body. Kind of notice that I'm having a kind of sympathetic nervous system reaction, that I'm going on high alert, and I can feel that in my body. And by starting to take that kind of that sort of bit of a distancing perspective on my experience, I mean, I'm getting closer to it on the one hand because I'm paying attention, but I'm also, by doing that, I'm not lost in the emotion. Maybe I can maintain a little bit of perspective on it and say, wow, I am really angry right now, and I know it can happen when I'm angry because it's happened before, and I'm now me. I'm speaking from personal experience. There are times when I've reacted in anger, I thought, oh boy, if I had thought for 2 seconds before doing that, I might have chosen a different response. So those are some of the strategies that we can use with mindfulness to start to slow things down, and then the mindfulness approaches intersect with our thinking and our behaving strategies, where if I've taken that little pause, then I'm in a better position where I can think and plan my behaviors in better ways.
So if I started to do this program and I was working on a certain emotion, is there, what would I expect to experience? What is the journey like over time?
Well, so, initially we're going to define some goals and then identify what the treatment plan is going to be, what things I'm going to want to focus on. And then generally each week we want to make a plan for the kinds of things I'm going to want to be practicing. And I mean, I think what most people find, certainly what I find myself, is that it's not an entirely linear process. Meaning it's not a straight line that's always on the up and up if we're trying to change things or improve things. So there are going to be times when we react in a more helpful way, the way we're intending to, and there are times when our old patterns are going to come out. And so I think that's a central part of the work, is in accepting that we're not going to be perfect in how we do it, and that's perfectly all right. And in fact, that's exactly what we should expect. So I always encourage a person starting out to bring hopefulness and optimism, and also skepticism, and to say, let's see how this goes. We'll try out some new things, and if I'm willing to do that, chances are that I'm going to get a lot of benefit. But you don't have to be a true believer when you're starting out. You just try things and see what works.
Which I think is very accurate, because from having talked about similar things to this before, I know it takes a lot of time, and this is not a world where we feel like we have time. And of course, if we're, say, 40 years old and we're working on changing a thought pattern that we've had since a child, it's not going to change in a week. It's going to take a long time for us to be aware of that. So, I want to stress that, because, you're saying come in with skepticism, but also come in with the reality of that this isn't going to happen right away, so you have to put the time and the effort in to make those changes.
Yes, yeah, and if I could just add, I think that in some ways we may have oversold CBT if we're advertising it as something that's going to completely change you and completely change your life. And I don't say that to mean that CBT can't be life transforming, because it certainly can. But I think that it's important to. I think what I really find valuable about the mindfulness part of CBT, what I call the B part in my Think, Act, Be approach, is that a lot of it is acceptance, and maybe accepting that I'm going to feel anxious at times. I'm going to feel more anxious than I want to at times, and I'm going to have days where my mood isn't where I want it to be. And maybe that's okay. Maybe I can have a life that feels meaningful and deeply satisfying, even though I'm going to have days and episodes like that. And so I don't want to undersell or oversell CBT. I think it's good to kind of keep it in perspective.
Well, I really like that you said that, because when we're working towards a goal and changing certain behaviors or certain things, whether this is about physical or mental health, people always tell me they want to go back to the way they were. And I have to explain to them that they're not going to, because you can't go back in time. And you're having an experience that you're learning from, and it is going to change. You are going to change. Whether, it doesn't mean that you're going to be sick or you're going to have anxiety or whatever it is you're experiencing. But when you get to a point where you feel like your life is more under control, it's not going to be the same as it was when this started, or it's not going to be exactly what you want, because we're still human and we have feelings, and our health is never perfect. Nothing is ever perfect.
No, and that's such a valuable perspective that you offer the people that you work with. I mean, to be honest, so publishers usually have the final say in book titles, and yes. I had some concerns with my first book about how aggressively, you might say, were they going to market the effectiveness of this program, and I was really pleased and grateful that they described it as a 7-week plan for managing depression and anxiety. I think managing is the right idea. If they had said a 7-week plan to cure your anxiety, I'd say I can't stand behind this. But really, it's about managing things, and yes, things can improve, but you're still going to be you.
Yeah, well, and I think if we go back to the example of driving after an accident, you still might be afraid in certain situations, but you might still be able to drive, which would be the difference if you were so anxious you couldn't. You might still have some of those feelings for a long time until you realize, I can see in some situations you would realize that's not valid, but then you could, sometimes the anxiety could rear up years later because it still is there. And I think that's also recognizing how human we are, that we're not without emotions, and we can't go through life without experiencing them, but we can go through life experiencing them in a healthier way and having better tools to deal with them.
Yes, Rebecca, you and I think really along the same lines here, because if we've resolved that we're going to have a meaningful life and we're going to do what's truly most important to us at our core, regardless of challenges that come our way, then I think nothing can beat us.
Yeah, I agree. I think if we do this work, whether or not we feel like we're in a paralyzing situation or we just want to assess our thought patterns, I think it's very common to have at least a few unhealthy thought patterns just from wherever those come from, being alive. And right. And it's no different than saying, I'm going to eat different because I want to be healthier, even though I don't have high cholesterol or blood pressure. I want to be better. I think it's the same dealing with our mental health, that we can take that to a next step, even if we are well, so that we don't get unwell, and we can maintain our health or work towards a goal if it is something that is in our way.
Yes. Somebody once said to me that she learned from her grandmother when she was a little girl, when they would go to the temple to pray. Her grandmother told her, don't pray that your life will be easy. Pray for strength to manage any challenges that come your way. And I really was inspired by that. I think that's such a useful way to think of it. And I think any therapy that we're doing might think of that way as a way to help us manage what comes our way, and not necessarily to make our lives completely easy.
Yeah, I always tell people if they were easy, we wouldn't grow up. We wouldn't have any lessons to learn. If you, good examples, if you never got lost an appointment because you were late and they always fit you in, you would never learn to be on time. So we have to learn to have certain behaviors, and those are done by trials, and some are harder than others. But I think it's really important for us to be able to do that with a compassion for ourselves and that awareness of what is going on in our own minds and around us.
Yeah, maybe what we're talking about is being able to find maybe moments of ease, even when things are not easy. And I think maybe that's a big
I love
mistake.
that. Yeah, that's exactly what I'm trying to get. So, Seth, I've enjoyed our conversation. Your book has way more information in it. So is there a way that people can get a hold of you or your book if they want more?
Yes, definitely. So you can find me probably most easily on my website, just my first and last name, SethGillihan.com. There are links there to my books. You can also go to Amazon and do a search for my name to find my books, or if you put in cognitive behavioral therapy, I think these books are some of the first to come up. And earlier this summer, I started a podcast. It's called the Think, Act, Be podcast. So I've got several episodes up. They're coming out each week, so people can find that through my website or on iTunes. And I have a blog on Psychology Today of the same name, Think, Act, Be blog on psychologytoday.com.
Well, that's perfect. I want to thank you so much for joining me today.
Well, thank you, Rebecca. I really appreciate the work that you're doing and the chance to talk with you about my work.
Well, perfect. Thank you so much. We were talking today with Seth Gillihan, and his book is Cognitive Behavioral Therapy Made Simple. If you want more information about my story, you can find it on my blog site at dr-risk.com. Also on your favorite social media. Thank you so much for listening, and just be sure to make today a great day.
Thank you for tuning in to this week's edition of Falling Through the Cracks. Feel alive and thrive. Please join Dr. Rebecca Risk again next Monday at noon Eastern Time and 9 a.m. Pacific Time on the Voice America Health and Wellness channel. We'll talk more next week.